One of the main missions for Driscoll Children's Hospital is not only succeeding in curing every patient, but ensuring that every patient has a clear understanding of the medical treatment being done to them. Specialists are realizing these forms of understanding can come in something very small, something as small as a duck. 2-year-old Mackenzie Flores stared at her collection of dinosaur play figures as child life specialist Leah Naraki started to unravel what appeared to be a white ball of fur.
A valuable resource we have here is many child life specialists, and what they do is they're trained in development, in child development, to be able to normalize the hospital experience based on the child's understanding. And there's a lot of distraction techniques they can use. They have, the duck is going to be a wonderful tool for some of our littler kids that can't really explain what they're feeling, but if they see the picture, they could say, oh yeah, I'm nauseated, and then put it on there, and then they'll be able to communicate that way.
My job is to make sure that when kids are at the hospital that they understand what is going on. And so it's kind of like being a teacher in the way that I help kids understand things that are going on in words that they'll understand, making more difficult medical phrases, things that are concepts that they can more easily see, or just kind of like let it be something that kind of is part of their understanding as they go through different medical procedures. Well, we've been able to give quite a few of the Aflac ducks away, and so the way I'm using it is a little bit different for every kid. And so I'm introducing it based on the idea of like what they know about their Metaport or their central line, and so I usually introduce it as something that also has a button or a Metaport device. Sometimes they call it a disc, and so I'll introduce it based on what they know. Explain that it can also get like medicine like them, remind them that there's this also used, to draw blood. And so it's really a way to just kind of like let them kind of have that control over, one aspect of the medical procedures they receive. And another way is just like using it to like help them identify their emotions. Really just using it is one more way that really kind of like normalizes their experience. And like there's a stuffed animal that has something just like them, and that like somebody else understands what they're going through.
Because it's very difficult when you're dealing with children. You have to know what their symptoms are to be able to help. And even sometimes the parents don't know what their symptoms are. How is a little 2-year-old going to explain, I'm nauseated today? So if they have the duck, then we may be able to get a clue as to what we need to do to help them.
The duck has been given to numerous patients, proving to be successful in conveying messages and the feelings of the patient. With Coastal Bend Today, I'm Erin Garza Granados, your life, your news.